First, there are two ways to go about creating affordable quality health care that everyone can access, because that's our goal. Everybody in this room and in our state and our nation needs to be able to have affordable quality health care that they can access. Now, how can you do that? Well, the plan that's been put by the Democratic Congress before us, and which is basically supported by the President, is something called, the technical name is H.R. 3200, but the big thing that's gotten a lot of attention is a so-called public option. It's a government-run insurance plan that would be put out there and Americans would be encouraged to take advantage of it. Now, you can say that no, you can keep the insurance that you would want to have, but when you tilt the table so that everybody basically comes down to one option, it may be that you can keep the plan if you want to, but by golly, most likely you're going to end up in a single plan. And the folks like Barney Frank, he's on YouTube, they asked Barney Frank, they said, Barney, why are you for this? I thought you were for single payer. And he said, well, if the public option's done right, it'll end up at single payer. I'm okay with the way it's going. So it's pretty clear where that group is. In fact, there was a White House senior advisor, he didn't give his name, but he's quoted in one of the newspapers in Washington, D.C., who says it's the left of the left. Now, this is the White House's senior advisor saying this. It's the left of the left that is pushing this. So again, I'm not trying to speak bad about anybody, but I'm just quoting the White House when they say it's the left of the left that's pushing this public option. Now, I personally don't care for that, because if one of the problems we have now is a insurance company bureaucracy that we're not sure about, that sometimes is not responsive to our concerns. The crazy thing about this radical public option is all it does is replace an insurance company bureaucracy with a federal government bureaucracy. Now, the crazy thing is, I've got 5 or 6 staff people, and you'll meet some of them at the end, who are in my office just to help, and we're here once a month or once a week, here to help you interact with the federal bureaucracy. So if you have, by the way, let me just put a plug, we're here to serve. So if you have problems with your Social Security, your disability, the Veterans Administration, you come talk to my staff. But the very fact that I have those people tell you that sometimes the federal bureaucracy is a tough thing to deal with. So I told my staff, if this public option passes, we're going to have to hire 2 more people just to take care of the issues with the public option. Now, by the way, it's not going to go into effect, and the new public option wouldn't go into effect until 2013. I thought, isn't that odd? They planned it until after the next presidential election. But that said, I mean, I'm not accusing them of anything. Now, I don't like the public option or this reform plan for several reasons, but one is the problem facing our country right now is we have a huge federal debt. Now, in this parish, you have had to make tough sacrifices from avoiding a public debt. I read the paper. Y'all got some contentious meetings. Y'all are fighting to balance the books. In the Louisiana House of Representatives, I joked the other night, Mert Smiley used to be blonde, and now look at the guy, he's all gray. That's because in the Louisiana legislature, they had to fight this past year to balance that debt. Hey, Washington, D.C. is pretty easy. All you do is print another $1 trillion. And that's the problem. There is no discipline in terms of how you balance that debt. And so this plan builds upon Medicare and Medicaid. Now, Medicare is going bankrupt in 2017. Now, for those of you on Medicare, we will do something to rescue Medicare. But the fact is, the money you and I have been paying into Medicare, they're running out of it. In 8 years from now, they predict that the trust fund that finances Medicare is going to be bankrupt. Now, you don't build reform on a program going bankrupt. It's like Scripture says, it's building your house upon sand. That's not a solid foundation. Next, they want to expand Medicaid. Now, Medicaid is the program that covers the poor. And right now in Louisiana, if you earn like 40% of federal poverty level, you would qualify for Medicaid. They want to increase that to 150%. Now, the reason that these men and women fought so hard in the last legislative session to balance the budget is because, among other things, the huge problem with Medicaid. In our state next year, they may have to cut $1 billion from Medicaid. Now, this is the program the federal government wants to expand. That means either the federal government pays for it all and adds that to the trillions of dollars of debt that we have, or it forces us in Louisiana to pay for it, us either raising taxes or cutting other programs. This is another program we should not be building reform upon. It is a foundation of shifting sand. Now, these are the public options that are being put out there. Now, there's a lot of things we could say, but I'd rather respond to your questions. But rather than just criticize what I think is wrong, I'd also like to discuss a better way, what I think is a better way to do it. Right now, the way that Medicaid or Medicare attempts to save money is there's a bureaucrat, and he may sit or she may sit in Washington, D.C., or may be in Baton Rouge or may be in Dallas. And they try and dictate the interactions you have with your physician here in Livingston or in Denham. Now, somebody in Washington, D.C. is making decisions to try and control your interaction with a physician in Livingston Parish. That's about the craziest thing you ever heard. But if you want to see some other crazy things, come visit me in Washington, D.C. Because it's not going to work. It's like being given a credit card to go to Target or Walmart or Macy's and being told from Washington, D.C. that you can only buy certain things, but we don't really know what's out there, and here's the credit card. Well, the fact is, folks don't have the guidance they need to make the decisions, and they're a little separate from their decisions. There's some other ways to do it. And those ways that I would advocate are called patient-centered things. What's a